Hello, our group is going to talk about respiratory syncytial virus, also known as RSV. We hope our presentation answers any questions you may have about this virus. My name is Nicholas Seedall, and I'm going to talk about the etiology and reservoir of RSV. The scientific name for RSV is respiratory syncytial virus. As the name indicates, it is a virus. RSV belongs to the Paramoxiviridae family and the genus Pneumovirus. Some interesting morphology of RSV is that it has an envelope and contains a negative single strand of RNA. RSV's nucleocapsid is smaller than some of the other viruses in its family and has two glycoproteins, F protein and G protein, that extend outside of its envelope. The G protein plays a major role in attachment, while the F protein directs viral penetration by membrane fusion. RSV produces syncytia, which are large multinucleated cells. These cells are formed through the virus fusing membranes together of other cells. RSV viral gene expression and RNA replication goes on in the cytoplasm of the cell. These new virons acquire a lipid envelope by budding through the plasmid membrane. This virus can express itself in two strains, A and B. Strain B is asymptomatic, while strain A is symptomatic. Symptomatic means that the patient is showing signs and symptoms of the virus, while asymptomatic means that they are not. The best way to identify if a patient has RSV is through detection of viral antigens in respiratory discharge. There are three ways to check this: nasal wash, nasopharyngeal aspirate, and nasopharyngeal swab. The first two ways can identify RSV easier, but it requires specialized equipment, while the swab is more accessible and pleasant for the patient. According to the Journal of Virology, RSV was first found in 1956 in a laboratory chimpanzee. It was soon determined that it had originated in humans and was a major cause of serious pediatric respiratory tract disease. The virus infects the respiratory tracts, particularly in infants, young children, and older adults. The CDC reports that each year, on average in the United States, RSV leads to 2.1 million outpatient visits among children younger than 5 years old, 57,527 hospitalizations among children younger than 5 years old, 177,000 hospitalizations among adults older than 65, and 14,000 deaths among adults older than 65.
Hi, my name is Miranda Sommers. I am going to talk about the signs and symptoms of RSV. When we talk about signs, signs is something that observers can see and not have to be told. Symptoms are subjective. In order to know about this problem, the patient has to inform the observer. In the medical field, doctors and the nursing staff use their own terminology when writing and talking. The medical term for signs and symptoms is SNS. And signs and symptoms are very important to help diagnose a patient. If you don't know what is wrong with them, then it can be very difficult to diagnose and treat someone. When dealing with RSV signs and symptoms, they usually appear within 4 to 6 days after being exposed to the virus. In adults and children, RSV can be mild. In infants and geriatric patients and people with lungs and heart issues, RSV can be very severe and in some cases life-threatening. The signs and symptoms of RSV can be very similar to the common cold. and can be self-treated. A few of the signs and symptoms consist of runny nose, dry cough, low-grade fever, which is 98.6 to 100.4 degrees Fahrenheit, or 37 to 38 degrees Celsius, and a sore throat. If RSV spreads, it can cause more severe issues, such as lower respiratory tract infection, which can lead to PNA, which stands for pneumonia. It can also lead to bronchitis. Signs and symptoms include a high fever, which is 100.4 degrees Fahrenheit and up, or 38 degrees Celsius and up. Severe coughing, wheezing, rapid and difficulty breathing. Some people want to sit up because it feels like it's easier to breathe rather than laying down. Some patients turn a bluish color due to low oxygen. When an infant has RSV, usually they have severe effects they can be hospitalized. Some signs and symptoms a baby might have are shallow and rapid breathing, cough, poor eating. They might become lethargic and irritable. When to see a doctor. RSV can be very similar to the common cold and can be treated at home, but sometimes this virus can spread and be very severe. If you experience any of the following, you might need to get medical attention. Get medical attention if signs and symptoms worsen or new symptoms appear, if you have trouble breathing and chest pain, if your symptoms worsen, if you have trouble breathing or chest pain, a high fever, mucus that is yellow, green, or gray, if you have a child that is sick and is less than 6 months old, seek medical attention immediately. If signs and symptoms have lasted longer than a week, seek medical attention.
Hi, my name is Reeb, and I'll be talking about how RSV is transmitted. When I talk about transmission, I'm talking about how you can catch the virus. RSV can be transmitted through those who are already infected. But how? Well, you can have indirect and direct contamination. With direct contamination, you'll have to kiss someone, have someone cough on you, or sneeze on you. The droplets, in this case the saliva, is what gets you sick. With direct, I mean when you touch doorknobs, the counters, the surfaces, anything that can hold droplets for a while. When you normally touch something, you forget about it and you touch your face, you put your hands in your mouth. It's an easy transfer because the virus can live on the surface for a couple of hours. The easiest way not to get RSV is to stay away from those who already have it. Keep in mind, just like any virus, it's easy to spread when you come into contact with. There will always be a chance that you will get RSV. It is most contagious within the first 2 to 4 days, and RSV can survive for a long while and surfaces have already been infected. Children are probably the easiest ones to get RSV, only because they are often out in the public more so than adults. They're in school, in daycare, and after school activities. In some cases, they have no signs. So those who have it don't stay home, and when they don't, they can spread the virus.
Hi, my name is Villaneda, and I will be talking about the different treatments and how to prevent and control the spread of RSV. Most cases of RSV can be managed at home under the direction of a physician. Some of the treatments for RSV may include over-the-counter non-aspirin medications such as acetaminophen or ibuprofen can be used to reduce fever and relieve discomfort. It is very important to drink plenty of fluids to prevent the onset of dehydration. A humidifier can be used to relieve congestion and thin mucus in the airways. Nasal saline drops in a bulb syringe can be effective in suctioning and managing thick nasal secretions. Your doctor may prescribe an antibiotic if a secondary bacterial infection develops. You should avoid exposure to cigarette smoke. This can exacerbate the symptoms of RSV. Severe cases of RSV may require the need to be admitted to the hospital. Hospital treatment may consist of the following. Acetaminophen or ibuprofen may be given to reduce fever and treat discomfort. Intravenous fluids may be necessary to treat dehydration. Humidified supplemental oxygen to treat hypoxemia, which is low oxygen levels in the blood. Bronchodilators and corticosteroids may be beneficial to those with a history of asthma and chronic lung disease. And in the most severe cases, RSV may require intubation and mechanical ventilation. There are precautions you can take to prevent the spreading and contracting RSV. Some of these include covering your mouth with a tissue or your upper shirt sleeve when coughing, washing your hands often with soap and water for 20 seconds, avoiding close contact with those who have cold symptoms. If you or your child are sick, stay home. Clean and disinfect all hard surfaces that might be contaminated, for example, countertops or doorknobs. There is a drug available that prevents severe infection with those who are high risk for contracting RSV. It is called palivizumab. It is comprised of recombinant humanoid monoclonal antibodies that directly bind to the mature F proteins on the surface of RSV. This prevents the virus from infecting healthy host cells. Palivizumab is a monthly intramuscular injection given during the RSV season, which begins in the fall and ends in the spring. Thank you for watching, and this concludes our presentation.